Hi guys, Anthony here from Inner City Helping Homeless. Apologies we haven't been able to give you a live update in regard to what's been going on over the last couple of days, but as you can only imagine, it's been absolutely bedlam and hectic to some extent here at ICHH. We'll give you a quick update in regard to where we're at. Service level provisions, we've had to reduce our day service due to HSE guidelines and the levels of people that would normally access our building, in particular clients. We're trying to encourage best practice in terms of HSE guidelines. Our outreach support teams have also been reduced. Unfortunately, our walking teams are no longer available on the streets, but we have increased the number of mobile outreach units that we have on the streets on a nightly basis. All our teams are on a mobile outreach unit from Monday of this week. So our outreach support services are continued. They will be continued to maintain for as long as we possibly can. And again, using best practice guidelines in terms of volunteer safety and client safety. We're still engaging with up to 90 to 100 people every night of the week on the streets. We have not seen a reduction in the amount of people that are sleeping rough, although there has been an increase in the amount of people that are accessing the hostel system. That's unprecedented. We've also been in contact with government and the DRHE in regard to the amount and the levels of people that are accessing the hostel system. It's very hard to physically distance or practice any kind of social distancing within the hostel system with the level of people that are accessing many of these units. With some units, there's up to 70 and 80 people per night staying within these facilities, which is totally unacceptable. What we're looking for is own door access within these facilities, that people can access these units without having to socially impact with anybody else. This is difficult. The DRHE are working on trying to do that, but I suppose the supports from government need to be better in terms of how we actually manage that and how we put these people into place. Over the last couple of days, we've seen a high level of people that have been released from the prison service on temporary release. These people have been released into homeless services, and that has put a strain on homeless services in regard to the level of bed and bed management available, and again the amount of people that are accessing the hostel system. Through our day service, we are still operating a major effort in terms of food redistribution. We're now engaging with old folks and senior citizen complexes right around the city. We're managing to get to them with people that are isolated or self-isolated or have been told to isolate by the HSE. Our food parcel provisions are being sent to those people on a daily basis. That over this week we've seen about 2,500 people who are engaged with in terms of food parcel provisions. That's put a major strain on us as an organisation, as we are operating with skeleton crews and trying to again stay within HSE guidelines in terms of safety of our staff and volunteers. We are putting pressure on the Minister in regard to the European feed grant. We haven't seen an increase in the allocation of credits that we would normally have through that grant system, and that has put a big strain on our warehouse facility in terms of getting that food out to the people that do need it. A lot of people have lost their jobs, and we've seen a new wave of people that are looking to access that grant and that grant availability. We are asking businesses that have closed down, if you get in touch with our office 018881804, we'll ensure that any of the stock that does come in is redistributed to the people that need it, whether it be in the homeless service system, the hostel system, B&Bs and hotels that are accommodating people, and old folks or senior citizen complexes around the city. I suppose the message from us is stay safe. People have asked to physically, socially distance. You know, the only way we're going to get rid of this virus, or the only way we're going to manage to get over, I suppose, this unprecedented crisis that we have in our hands, is for people to take the advice of the HSE and take the advice of officials as it's being given. Frontline services are still trying to operate to the best of their ability and will continue to do so. So we're asking you to continue to give us your support. Everybody stay safe and be safe.